All right. Thanks, Guy, for your patience. Let's start. So Sustain Health, I found Sustain Health in 2009. So I've been working here ever since for 20 years. So weekly, I'm more than 100 patients that I've seen. And I work a lot with cancer patients, different stages, including breast cancer. Also, I have a lot of Chinese medicine students who come through the clinic that I mentor them as well to show them how you practice Chinese medicine acupuncture. I have a degree from Bachelor of Medicine from Shanghai University of TCM, and I treat a lot of fertility and issues with patients who are going to get pregnant. So I have a Master in Reproductive Medicine from University of New South Wales, and I have a PhD in Chinese medicine from Guangzhou TCM University as well. So that is my background. I just show you guys what is my snapshot of my current patient database. So Chinese medicine is holistic medicine. It's not like we just treat the specialized names of the disease. We treat the person that having a particular issues, either cancer, either thyroid problem, either autoimmune inflammation, kidney disease, neurological, anything. So that is where holistic medicine means. Doesn't matter what the modern terms or modern medicine categorize you in. We take it as information, but how we're going to approach the person to help them to reduce suffering and the symptoms and what they perceived that they have to get better is through not from the symptom or reductionism way of thinking or mechanical, but it's more on the holistic view of a person and how we can balance the person and make the mind, body, spirit all working together toward one goal and one goal only, which is to heal. The person ability to heal, they probably have less issues and less symptoms and less chronic problem in the body. We call that prevention. And then you don't just treat the symptoms when they happen, but if we have ability more in tune with the body, that actually we can help to prevent the problem from happening. So that's why you see we break down all of the patient that I see in my clinic is not because we treat everything, but because we don't treat as such as a disease, but we try to look at the more holistic view of the person. That's how we can help so many type of patient, including cancer patient. And like I said, over the years, we have more cancer patients come through the clinic with cancer support. So that is where I try to, share this talk with you guys to share my insight on how cancer patient can benefit from Chinese medicine acupuncture philosophy. So to share with you guys what type of cancer that I see in my clinic. This is four different stages. A lot of patients come in when they just get diagnosed. So that is where, before they start any cancer patient, they go through shock, they probably confused, they, fear, they have, too many opinion option, so a lot of information. So at that stage, we already started to help to support the patient to be able to calm down, have clarity, to be able to, ground things a bit. That is where we start to see a lot of patients at that stage. And then what we do is we can help the patient to be able to build up immune system, or if they have any discomfort or symptoms from the cancer, we already can start supporting that. It's not about curing the cancer, but supporting the patient, mind, body a bit more stronger to be able to navigate through the option that they have to do when they're going through the cancer journey with Western medicine. And of course, mostly the patient that we support is when they're going through the cancer journey, like most common is chemo, radiation, as well as some of them will be required to do some surgery after the chemo. For breast cancer, for example, they sometimes have to do some surgery after the chemo as well. So we support them through that process. So very common things that patient have side effect from chemo can be fatigue, nauseous, any digestive symptom, pain, and appetite, low red blood cells. So if they're getting weaker halfway through the chemo, then need to be able to have a stronger constitution. If they cannot cope, they probably cannot continue with the chemo treatment as well. So they may be on steroid to help them. But again, we try to not using a strong drug when patient going through a lot. So we try to use, if we can use acupuncture or some patient taking Chinese medicine to help them to go through that, chemo or radiation treatment. We have some patient who going through biological drug as well with the side effect and things would help manage that. Not as much in breast cancer, but other type of cancer. So we support those cancer patients going through biological drugs treatment, and they have different side effects. So regardless what kind of drug, latest drug they are on, I don't really care about that drug, and it's more about the patient that present in front of you that is really with different, maybe they're vomiting. So we just help to support it. They may be an anti-nauseous that is working or not working. So help to bring down those symptoms together with Western medicine, because sometimes one type of approach, they not even stomach anything. So we need to use acupuncture to bypass the oral pathway, which is you can use a neural pathway of the body or the organ acupuncture point, or you can use meridian. Because if oral pathway is too busy, they cannot cope anymore. You don't going to put more medication into it because it's not going to work. And the third one, I have some patients who don't really chose not to go down the Western medical path as well. They try to manage it naturally. So we use acupuncture and Chinese medicine help to support those patients as well. I have a small handful of patients who chose not to do any Western medicine treatment, and then even the checkup as well. So I help them to be able to stay afloat, and there is the idea of when it's not about curing the cancer, but living with the cancer as well. And the last one, the fourth one, will be the remission of cancer. So we help to support the patient to be able to stay in remission, very strong body, strong mind, and then any like fatigue. I see a lot of patient with fatigue symptoms, emotion, like anxiety, depression. So we help the patient to be able to stay the best form they can to stay in remission from cancer. On this slide, I want to touch about our Chinese medicine look at breast cancer. So emotion is the biggest one. So that is where we take the holistic view of the person. Emotion definitely is one of the things that have, present in our clinic, that not only for breast cancer, any gynecological type of issues like uterus fibroid, cysts and stuff, that is really because that is where you look at the Chinese medicine acupuncture, the meridian, they go to the breast and the reproductive organ. They will be where the liver channel go through the nipple area, and the stomach channel, which is digestion, they're going through the breast area. And also there's some kidney channel they go through in the middle of the breast area as well. So that is where emotion, when they get blocked, there's always very easy to have blockages along that channel, especially liver channel, which were very related to the emotion, especially the anger. So when you already have a lump in the breast, that means stagnation already happened. That normally means the qi and the flame, there's stagnation. So the stagnation, they become blockage. And then sometimes can be malignant, sometimes they can be benign as well. But regardless of what type of, lump it is, in Chinese medicine, a different way we can help to manage and soften and soothing the lump. And Chinese medicine we don't look at the breast cancer patient, we just look at the breast. We try to look at the whole person to see where is the major conflict, the problem is. Sometimes, a lot of time can be in digestion, can be in liver. If there is a fear, then in kidney, a lot of times anger. So we try to look at the other aspect than just looking at the breast cancer itself or lump itself. So like I said just now, the imbalance of the qi and the energy, and that is where we look at what meridian going to the breast, which is the liver, going to the nipple, because the stomach, and the kidney. Sometimes the kidney, you talk about the emotion like a fear and stuff, they relate to the kidney organ. So how we every day in the clinic to help to support the cancer patient and breast cancer patient. Then obviously we have a tools called acupuncture, which is very effective in helping to reduce the side effect from the chemo and radiation, or even hormonal therapy. Like if you have hot flushes and the heat, we see a lot of patient need to be managed with hormonal therapy. We help to manage the hot flushes and joint pain or whatever the symptoms that may have that arise from the hormonal therapy as well. And the thing is, you can't just look at the side effect and just manage the side effect. You look at the emotion side, and you look at overall health, digestion, energy, vitality. All those sort of things need to be putting into consideration to be able to help the patient than just working on the mechanical, the symptoms only. If you want to have more sustainable outcome and the management, then you need to keep the whole person well. Post-surgical recovery. So a patient go to surgery after the cancer, then it's more like a soft tissue healing, the pulling, the pain, don't want to take too much painkillers. Yeah, all those sort of things, we can use acupuncture to help as well for the recovery. Neural pain, which is very common, nerve pain, which is acupuncture is very grateful. And we do a lot of scalp acupuncture, neural acupuncture, which can help through the head and the scalp. We can help to modulate the nerve signal to be able to reduce the pain as well. So these are common symptoms that we see in the clinic, which is can happen to see in a lot of cancer patients. Neuropathy is a quite a common one, CIPN. So post chemo, depending on how much toxicity it is, sometimes it can be very strong, take a long time to manage. If it is a weaker drug or less toxicity and not affect the whole body that bad, I think it's a lot easier to manage. But if it is, you wait until it's very late, until all the nerve is damaged quite badly, then you take a long time to manage it. So depending how much nerve is being damaged. So my advice is the earlier the better before it get through the whole body. But that is where CIPN is quite a common one. Integrating Chinese medicine into cancer care. So I think this is what I try to promote to into modern cancer case, to have more holistic view of cancer patient. Then we don't look at just the cancer itself or looking very micro. We can have a holistic view of the whole person. So for example, for cancer patient, you can help to balance between mind, body, spirit, and the relationship with the society, relationship with your family, relationship with the situation, relationship with yourself is how to achieve in harmony. Harmony is a key point for Chinese medicine, Chinese culture. Any medicine or philosophy from agricultural society that we talk about harmony is a way of diplomacy that you don't need to fight everything, or you have to win, or you have to lose. There's a wisdom that we can live together with things. If we don't have enough wisdom to solve the problem, we can leave it later. We don't have to fight it and be 100% of everything, because sometimes too radical and too high standard is not necessarily doing you good, because health and business or corporate is two different things. In corporate, in modern world that we live in, then we define success or is to be 100%. We have a lot of information, but information definitely not the wisdom that we want. We need wisdom. We have a wisdom to help to solve problem and deliver outcome. It's not only with the black and white. And that is where we can say if we don't make things that of only the outcome focus, or we try to see if we can help to sustain. This is what we call sustain health as well. Sustain to live together and with quality of life, with dignity, with independence, with confidence. So those sort of things how we can incorporate that into the healing journey with us reduce the suffering as well. So it's not about just fighting the cancer. I think there is many things that we can do to help to live with cancer. And then, you know what, a lot of time I find the patient once, if you can achieve a little bit of harmony, I think a lot of symptoms, I don't need to do too much of the work because you become a good responder to anything they want to do in your life with your cancer journey, including Western medicine, not only Chinese medicine, acupuncture, just about everything that you do, even with Western medicine. So again, balance. Balance is the key. Balance is if we can minimize the emotion of, that we talk about just now with negative and anxious or fear, and that can help. Because if you look around in the world that we live in, if we talk about terrorism, every country has some terrorism. As long as we can keep them at the border, don't get them come into our major city, affecting our life. As long as they don't convert the good villages into the terrorism as well, we can just corner them because you're so strong, they won't affect it. We can live with that. It can't be perfect, but again, we have a strength to be able to push them at the corner while we pursue our quality of life, go back to work, be whatever role that you have in the society, to be a mom or be a grandma or anything they want to do, and life goes on, because that should be a good quality of life. And then that is where we try to thrive to achieve that balance for the patient. So navigating the cancer treatment. So I believe you guys, while going through the cancer journey, there will be a lot of information, there will be a lot of opinion. People try to help you, give you different things, different opinion from different experts or this and that. I think that will create a lot of confusion, and that consumed your energy, because your mind, if you have too many options, it's very stressful, and then you don't know which one. And also you know a bit, but not everything. And that is where you get consumed. If you get consumed to become a bit weaker, I think spirit-wise, it's not good you can't create an environment that is really peaceful and subtle. It become always volatile. And that is really not good for managing cancer or let the cancer to stay in remission. And that means uncertainties, and then the thought with, like I said just now, too many thoughts, too many options. And then that is where it's hard for you create an environment that is really peaceful and balanced. So our approach, like I said just now, when I say non-competitive, it's not like acupuncture or we do Chinese medicine. We have to be stronger than the drug, stronger than the chemo. We have to be more, if kill the cancer even more. No, we don't do that. We help with the cancer patient to respond better to the medication and navigate through the journey. We help them to respond better. You have to be a better responder. So you need to have a strategy. If you decided to choose to go down a path, you need to respond very well because you don't want to drag on. So that is where, if you come on early on, there's find any way that we can do to help you to become a better responder to whatever option that you chose to do for that particular project. And then mind, body, spirit, which I said many times already previously. You can't separate them because human is human. We are not ChatGPT. We are not more smarter than ChatGPT. We know more information. Human just need to be human. Your foot need to be on the ground, and you're living a life. Our body go back to the soul one day. It doesn't matter how smart or how strong you are. End of the day is that creating that connection and peace and living with some imperfect or terrorism. We need to have that wisdom to be able to have a life that fulfill with or without cancer. It doesn't matter. As long as you're strong, I don't think cancer will bother you that much. Acupuncture worked through something called qi. I believe if you done research on the internet, you probably find this qi word in Chinese medicine, acupuncture. And qi worked through the meridians. Actually, the qi, to be simple, you follow the sun. Do you see the sun like the winter today in Melbourne? The sun flow through. We follow the sun. The winter is like in the dark corner, the water, the stale water that doesn't move. If the sunshine can come in, cover every dark corner, the stale water will be cleared. So that is we need a sunshine to be able to fight the cancer. Sunshine means positivities, mind that is open, and also to be able, want to do things. Our survival, want to fight it. We want to be able to stay on top. We want to get things done. So I think that is how we can bring the yang energy of a person. So yang energy, the yin and yang in Chinese medicine. So yang energy, the more I can instill yang energy through my acupuncture, my Chinese medicine philosophy, and any treatment, if you can maintain the yang energy strong, there won't be too many dark and yin energy that is stuck and become a lump or tumor in the body. The last one I want to touch on, what Chinese medicine text for the last 2,000 years already talk about is a Shen. Shen is a spirit. I know it's very vague, like what is Shen and spirit? But Shen, if I am strong, what is strong leader? How is your leadership to your body or to your families, to your communities? You need to be strong. And that spirit is not what on the document and what on the internet, what is written. And you show up with a strong spirit and Shen. I think it's very difficult to have a bad health or health that is difficult to manage, because without that, if you just focus on a bit more lower level management, it's very, you keep on chasing and one after the others. But prevention means if we can lead, then if we do all the right things to help every single dimension of the body, the material body, the mind, the spirit, energy, all flowing properly, I think that is the ultimate of good health, including cancer as well. Cancer just one of the disease, is not everything. If we are strong enough, we should be able to keep them at bay. So that is going to be all my presentation. No, this one was slide. Let me see. Yeah. Just now I talked about Chinese herbs as well. That's what we commonly do in the clinic. So a lot of things we can use acupuncture to help, but there's some things, for example, you need resources. I can't just use energy. You need to have resources they come from. Then you need to have manufacturing. So a lot of time we take very important of the gut. If you can help the engine to work better, the food that you eat 3 meals a day, you need to get more nutrient. For example, patients who have low red blood cell or white blood cell through the chemo. How do you help them? Do you give them more white blood cell or white blood cell? Now you help the gut to be stronger, working better, so that when they step up, the food that they eat can produce more white blood cells, so they can continue to do the treatment of the chemo. So that is increasing resources. And balance the body. Well, cancer is best case inflammation. If you address inflammation when the fire is very small, it's a lot easier. When it become spreading or stronger, of course, it's going to need more effort to have an outlet to, for example, acupuncture or herbs to clear that out of the body. And then this is how much we can help to balance the body through Chinese herbal medicine and acupuncture. And then lastly, Chinese herbs. In China, we use Chinese herbs like the last 50 years of all the cancer patients. Everyone take Chinese herbs back after the bags. 10 years, 20 years, 30 years. But again, depending on the Chinese doctors that you see, you can focus on the anti-cancer, but no matter how much you want to anti-cancer, the chemo is still the strongest. We just don't do anti-cancer. We have a lot of anti-cancer herbs, but the key point is not about anti-cancer. We can add it in. The key is you need to understand the person, which system is the weakest, and then you help to promote that to be able to stay on top, become stronger, so it doesn't keep on falling down, so cancer doesn't build. So that is where the key is, how to identify of that person, where is the weakest system, then we need to be able to help to get it stay stronger, so the cancer won't come back. So that is where not about anti-cancer, that's what I mean. It's about more holistic view than just focused on cancer. So I think that's it, all my presentation. So if you have any question, you can let me know. I'll stop sharing for now.
We did get a few questions in the chat.
Oh yeah.
So we had one that was asking the effectiveness of acupuncture to boost immunity of women on chemo.
Yes. Not the I don't give a jab and then your immune go up. That is Western medicine. How we do is we can use acupuncture to be able to depend what is the reason that you going down the chemo. Most of the time I find that is you compromise the spleen, the stomach, the yang energy not rising. It become a gloom and doom. So we open it up, and then the food that you put down to your body 3 meals a day. If we can't even get that fundamental working, I'm not sure how you can have a magic boost and buy something just to keep on overloading your system, which already overloaded, mind and the body both, and then you try to overload more. I think that is going to be how to say a lot of effort, but a little bit of outcome. But if we can use acupuncture, we can to elevate or open up to become more efficient, to get your gut to have less congestion from, say, if you're going through chemo, then you can enlighten the body a little bit. For example, the middle of the chemo, which the question related to the first question, which is middle gel, which middle gel in Chinese means the middle part of the body. This is overloaded, the liver, everything. So we have different acupuncture point to help with that, to make it less inflamed, less bloated. One of the most common metaphor I use with my patient, I can show them, I can demonstrate to them. Look at this is so hard, like a frozen meat. So my job, my ability to show that I can defrost that meat right there in front of you in the acupuncture session. And if you lighter in the head, that means it's rising again. So acupuncture, or I can help the patient to be able to do that. And then when it becomes softer, even you can feel more hungry afterward, that means already start to open up. It's not about one session make it free, make it fix it. It's about every time you go through the chemo, probably you're going to feel the same thing. So we help the patient to be able to recover quicker. So, in that way, you don't get your white or red blood cell too low throughout the chemo. Another question, Liliana. I'm interested in lessening muscles, joint pain, sleep issues, hormone blockers. Yeah, Liliana, like I said, I treat a lot of patient which is on the hormone therapy, hot flushes, sleep issues, joint pains, anxiety. They're all very common. We can manage it with acupuncture. And if you don't want to take Chinese herbs, we can just do acupuncture, which is very, very common things that we help patient. This acupuncture point can bring the heat down. But if your focus is on joint pain is like we treat joint pain, all type of joint pains. Then by just treating a joint pain is not enough. Again, we go back to which organ do you need to process that medication. Then we help to optimize that organ so you can have less joint pain. Or else you're just treating the symptoms. It's not about I have a natural way to fix it. More important word is holistic, not natural. Natural or not, it has to work. And you need to have a mind that you can connect with your body. So my job is not already lessen the symptoms, also showing you to be able to understand what you can do and think, and don't put yourself into stress situation. So in that way, you not keep on compromising that all the same way, the same time. And then they come down to, the behavior side of the things. So I think it's not just treat the joint pain. You want the joint pain, don't come back, then just relieve the joint pain. So we need to achieve a balance in between that. How can we protect recurring after and later? Like I said just now, it's more individual patient have a different stories, and then to be able to early stage breast cancer is like have a good happy mood, don't get stressed, and then always optimize the emotion. Sometimes I find that if patient going through when they're in remission, if they're going through some project very stressful and over a long period of time that cannot finish, you find that the patient very easily they forgot about themselves. They fall into the pitfall of getting stressed again because life going the way. If you're a mom, you still have to be busy. You still have to do this and do that, looking after the kids. Or if you're building a house, if you have a stress, yeah, you get caught out and then forgot about yourself. That's why I recommend to do prevention, even once a month for the patient. Even as a reminder, we tune out the patient, whatever it might be. Prevention always better than cure. By the time you have a lump, you feel like blockage is coming, is forming, we still can do work, but prevention always better, even once a month. Liliana, what is the cost? No, you don't need referrals. The cost acupuncture is 170, and then the first session is 240. You guys can speak if you want.
Hi, Scott. Can I ask something? I'm
Yes,
intrigued.
yes.
Thank you for the presentation. It's really valuable. I just would like to ask the frequency of the treatment.
At the beginning, if you're going through very strong chemo, if you're not doing very well, 2 to 3 times a week.
Yeah.
Once you're better, after chemo, the side effect is lessened once a week.
Okay. Thank you very much.
Thanks.
I have some comments, Scott, if it's okay.
Yeah.
My name's Megan. I was diagnosed with like a stage 3C breast cancer a few years ago now, and I've been using acupuncture, a Chinese medicine specialist, from, as you say, like the beginning of my diagnosis. I thought it was quite important to have it almost as a scaffold around, I got all my people. So my Chinese medicine specialist has been excellent, but I think maybe perhaps a little different from you in some of the approaches. She treated me when I was pre and post surgery, but before I started chemotherapy with Chinese medicine herbs. But her view was once I started the chemotherapy, I had, I guess, the strongest protocol of chemotherapy.
Yes.
With 16 rounds and the highest doses, etc. But her view was once that chemotherapy began, that the Chinese medicine, that she should not treat me with Chinese herbs, that only acupuncture at that stage, because the Chinese herbs can be so potent and influential that it can actually disrupt some of the ideas that chemotherapy is trying to do.
Antioxidant.
Yeah,
exactly.
exactly.
Antioxidant.
Yeah.
With patient going to chemo, a lot of time, like what you said, I don't do Chinese herbs too.
Yeah, so similar.
Unless a situation. Mostly I don't do, but if they are struggling to get the red blood cell out, if they run out of option, if they have more special condition, I will still do it.
There might be a case. Yeah, I felt like she explained it very clearly that her role as my Chinese medicine specialist was to support my liver, my kidneys, and my cortisol levels to, as you described, just get the flow going and process those chemotherapy drugs more easily. And also, I just wanted to comment to let other people know who might be earlier in their stage of treatment, that the acupuncture treatment I found really helpful for neuropathy in my extremities, my feet and my hands. So I just wanted to say how valuable I'd found it. I didn't go perhaps as frequently as you might recommend. I just saw my specialist maybe every 3 or 4 weeks, but I have done consistently for almost 3 years. So I just wanted to comment that I've found it really useful. But even since I've stopped chemo and radio, I'm on a stronger drug. I'm on the abemaciclib. If anybody else is on that, maybe not. But again, she said I have to wait until I'm off that drug before we can support with Chinese herbs. Anyway, I just thought I'd comment as someone who has used Chinese medicine throughout my journey.
Yeah, I think the reason the neuropathy that you have not a lot of side effect because you start the journey very early.
Yeah.
That's why I say the benefit. If you start early, if you already address that, we don't even have to treat neuropathy because it's not that bad. Then know what to do. Best is don't do any work because you're no symptoms. But like I say, because you start early, that's why your constitution you can handle throughout. I think that's the key. You say you're going through chemo drug very strong, but because you're strong too, that's why not a lot of side effect.
Yeah, I mean, I did have a lot of side effects, but it was, I did feel like when my neuropathy was increasing, I did feel like my acupuncturist was able to,
Yes.
bring that down again for a level that could cope.
Yeah.
And the only other thing I guess I would just comment on is I just feel really, maybe it's triggered, but when, I don't know, I felt like when you were saying that stress can cause a recurrence, I think we need to be really careful about saying that to cancer patients because we're all, nobody wants to have a recurrence, obviously. And I don't know, if it's an intimation that it might be our fault that we have a recurrence, I think that's just we need to be really careful about that intimation to a group of cancer patients. That's what I'd say.
All right. Thanks. Thank you.
Thanks so much.
Thank you.
I just wanted to touch sort of on the Chinese herbs along with your chemo as well. Absolutely, if you're going to be seeing Scott, you would have to go back to your treating team and discuss if you were going on any Chinese medicine. It's usually just generally recommended to do that as well. Yeah.
Yeah. Most patients, they have to go to ask their doctors before they can take any Chinese herbs. So, and then most of the time they don't get better to you anyway. So that's why I say don't do a lot of Chinese herb because sometimes they get back to you, sometimes they don't get back to you. Most of the time, like we just do acupuncture is a lot easier. But they just reality of, the patient that we treat. And one more question. Can you explain more about Chinese herbs benefit the body?
Yes, that's from me, Scott. My husband's on. I'm Sandra.
Sandra.
My husband is doing immunotherapy, as you know, and I just want to know whether your herbs actually affect or give side effects or stop the immuno from working, because he has been having some severe side effects, and I want to know what's in those herbs that you give him.
What is your husband's name again?
Core.
Oh, Cole. Oh, Cole, yes. Cole hasn't been taking much herbs at the moment because he's vomiting.
Yeah,
It's
yeah.
a side effect.
So, do your herbs affect treatment, or do they have an effect with the treatment or not?
Yes, for him, we are helping with the managed digestion for him. But again, after the taste of the herb changed maybe 2 months ago, and then the herb seems like not easy to swallow anymore. That's why stop the herbs on and off, and then there's different symptoms that occurred from the
Okay.
medication.
So, what are the herbs supposed to do? Just to reduce inflammation? Is that
No.
what they're designed to do?
Yeah, is to support the digestive system at the beginning from the medication that he's taking, that he's experiencing the side effect. But we don't just target the symptoms, but we try to support him more long term. So it's helping the gut to be able to process the food they have every day.
Okay, yeah, and they're not supposed to react with treatment, or not at all. So there's never been a case that the herbs have reacted with the treatment?
Not from my experience.
Okay.
Not from my experience, no.
Okay. Okay. Thank you.
Do we have any other questions? I have a question. Do you have a sort of any patient journey that really stands out to you that you can tell us about, or something that you've seen that's made a real difference to someone throughout their cancer journey?
Of course, I have a success and failures.
Of course, yes.
Success means the patient can live even forgetting they have a cancer. I think that is like with freedom. I think to me, the success look like not worry about what there's really living with confidence, living with staying well, and then do what they want to do. They go travel, they do things, and then just staying well. That is a success. That's a success to me look like. And then the patient that I have, that helping to stay in remission, that I talk about the prevention. I have quite a handful of patients that I'm helping them for 5 years, 6 years now. The same thing. You come monthly, every 2 weeks, monthly, just to maintain it. And some of them from Team Ping as well. So for me, success is don't need to do any treatment, but do what they have to do in life. And the key is not to just keep on thinking about the cancer and the remission with real confidence that from within is not is forget about cancer. So I think
Yes,
that is
Liliana, mindset is very important.
I think to me that real success look like I don't want to say I want there's true patient. When I do maintenance a year, 2 years, it become a flow in harmony. You just do and then come and flow and then not really focus on the conversation on the cancer or this product, this supplement is good for that. I taking this and do that, and then no, it's do nothing, just live normal. You talk about the general, more like a day-to-day life. And then I don't want to go into the conversation on the cancer. If I can, I always back off, always just go with the flow. Because the moment you talk about the word, you break the balance. You break the balance. Space is mutually don't need to talk about this, but knowing what we're doing. That would be the best, highest level I think that we can, get with my own ideal or success that you define with my cancer patient.
Great. And how can people get in touch with you or visit your clinic?
You guys can Google Sustain Health or Scott Ling in South Melbourne. I think you guys can, if you're interested, I'm more than happy to have a chat with you.
Beautiful.
Okay, some more question?
We've just got one more in the chat.
Peripheral neuropathy. Yeah, we talked about that just now a few times. Depend how bad is the nerve damage and how quick is your body going to recover. If your chi is very weak, it take a long time to recover. The nerve can recover, but take a long time if it is damaged. But the thing is, if you are strongest constitution, some people just recover just like that without even doing. I have patients who take a long time but not recovering as well. But that is already like quite serious damage. It's all swollen. So really depend what stage. That means the earlier you treat, the less treatment you need to have. The stronger, the longer you leave it, the more damage you have. It's going to take longer time. So we can stimulate the point around the hand to get more blood flows to the hand, and we can use scalp acupuncture. But the key is I need to look at how's the constitution. So if your constitution is blocked, doesn't matter how much I do on the hand on the scalp, most likely it's not going to get the best result. So it's best to see if your constitution need to be unblocked or optimized to be able to get blood flows to heal the nerve that on the hand and the feet. So like I say, holistic is better for better outcome than just focus on the neuropathy only.